Welcome to the 2019 nCoV outbreak update. Today is January 30th, 2020. Thank you very much for joining us. And for those of you who have previously attended the webinar, some of this will be repetitive, but it's important to note that you are presently in listen-only mode. You'll be able to type in questions to any of the presenters today. If we can answer them at the end of the session, we will. If not, we'll be happy to follow up with your questions after the broadcast. This event is also being recorded, and you'll be given a recorded email following the presentation. So no worries there if any of your colleagues missed the event. So we're really excited today to have two additional speakers with us. If you were on last week's broadcast, you may be familiar with Dr. Idix from the CDC. She's the Chief of Travel Health at the Division of Global Migration and Quarantine for the Center for Disease Control and Prevention. And she will be providing us guidance on what the CDC has been dealing with over the last week. And new to the team here is Mr. James McGregor, and Mr. McGregor is the chairman of Greater China Region for APCO Worldwide. He's also a former Wall Street Journal China bureau chief, been in China for over 30 years, and is an author of the eminent book on doing business in China called 1 Billion Customers. He's also a fellow expat of mine for many years, and he's going to give us some guidance on kind of what is happening on the ground in China and give that important perspective. So the agenda today is I'm just going to start with a brief intro. We'll have a CDC update. We'll talk about what's happening in the community, particularly in China. Then there'll be a series of benchmarking questions and polls. We get a lot of feedback that that's really important. We want to get that clients want to know what's happening and what people are doing. And then we'll talk briefly about what are some of the potential next steps and what organizations should be up to. So I'm not going to go into too much detail on the history of the outbreak, well articulated in many journals. So what we will focus on is kind of what's happened in the last week. When we spoke last week, we had 300 cases and 17 fatalities. Today, we're over 7,000, pushing 8,000 with 170 fatalities. So quite a rapid jump in activity, and it's leading to a lot of issues and events that are occurring, not just in China, but around the world. Also, if we look at kind of what's happened in a week, there's been a lot. We're learning more about the illness. The incubation period is getting better defined. It's not completely defined yet. The key thing that we're seeing, though, fairly consistently amongst the authorities and government agencies is a 14-day monitoring period. How long that incubation period is, whether it's 2 or 3 days or 10 to 14 days, a little bit of a moving target, and we should see that kind of tightening up as we get more data. How it's transmitted, it's a respiratory disease, so the presumption still is by droplet, coughing, sneezing, those types of things. And there is some concern about the capability of being contagious before you develop symptoms. There's been a couple cases of that, but it's not considered the primary type of transmission, and we're going to have to learn more before we really can comment academically on that. How serious is it? We're seeing 20 to 25% of the people being seriously affected by this, which means they typically need intensive care treatment, potentially a ventilator to help them breathe, and the fatality rate around 1 to 2%. But again, these numbers are going to move. It's all a question not just of the people that are sick and ill, but it's also who we're testing. Are we testing all the mild cases? What about people who are asymptomatic? So the general sense is that this is probably less severe than what we've seen with SARS and MERS, other coronaviruses in the past. The other changes we've seen human-to-human spread in China. Today we're seeing cases outside of China, and we can even talk about a potential situation in the US, I believe in Chicago, that's coming out in the news, just today. Travel been very much disrupted. We were concerned about Wuhan. Now, many countries, including the US, is recommending deferring non-essential travel to China. And we've seen airlines cut back and limit their service to China as well. We were waiting for the World Health Organization to identify whether this is a public health emergency of international concern, and they're meeting today. We probably will find out while we're in this meeting whether it is or not. There's a lot of contact tracing happening, and I just wanted to visualize, the really strong academic work that's occurring around the world, including at the CDC, and the type of detail that goes into tracking individual groups of people who become ill, and whether there is, secondary contact to people who weren't in Wuhan. And you can see this is an example from the Lancet, where they identified basically a mother-in-law that became infected and actually was not in the Wuhan area. So with that, I'm going to start with Dr. Ideks to basically give us the lay of the land, what's happening with the illness today. Is there any updates on this human-to-human case in the States? What's the CDC recommending for travelers to and from these affected countries and areas? And also any recommendations to organizations to, limit the spread in the workplace.
Okay, thank you. Thanks very much. I'd like to say a big thank you to Dr. Druckman and to International SOS for having me again. It's a pleasure to be here. And also just to extend a welcome to James McGregor. I'm very happy to have you here, and I'm interested in hearing your perspective. I think that Dr. Druckman did a really nice job of summarizing where things are at. I'll just expand on a few things and mention what CDC is doing. Obviously, the outbreak of novel coronavirus continues to expand in China. I will probably say many, many times today that this is a rapidly changing situation, and we are still learning about this coronavirus. So we're still collecting information, and what we know about it is likely to change. We do see person-to-person spread in China. Cases have been detected in a number of countries internationally, including the United States. I checked this morning, and China is now reporting, I believe, over 8,000 cases and 171 deaths. In most instances, cases outside of China have been associated with travelers from China, but some countries have reported limited human-to-human transmission, including here in the U.S. And as Dr. Druckman mentioned, the U.S. did report a case of human-to-human transmission in Illinois. The spouse of a confirmed case is now positive and hospitalized. And I think to date we have now over 20 international locations that have reported confirmed cases. So CDC is monitoring the situation very closely. We have been doing a number of different things since I'll mention the things that we've changed since last week when we spoke. First, CDC has activated its Emergency Operations Center, and we've started to use public health measures as part of a very aggressive public health response strategy here in the United States. We work very closely as part of this strategy with federal, state, and local partners to protect the U.S. from this. We do believe that in the coming days and weeks, we are likely to see more confirmed cases of this novel coronavirus in the United States and across the globe. I wouldn't be surprised if we continue to see more human-to-human spread. But our goal here really is to contain the outbreak and to prevent sustained spread. One thing that we've done in the past week, last week when we spoke, we had posted a travel health notice to recommend that travelers avoid non-essential travel to Wuhan. We expanded that to all of China earlier this week. One thing I'll touch on that Dr. Druckman mentioned is this issue of transmission when people are asymptomatic. Officials in China and elsewhere have reported transmission before symptoms appear. This is different from what we've observed previously with both MERS and SARS. MERS and SARS patients were typically most infectious when they were symptomatic and spread from person to person. They spread from people who had symptoms. and we really didn't observe people spreading the virus if they were not symptomatic. We continue to gather data on whether asymptomatic spread with this coronavirus may be happening. We're doing contact investigations here in the U.S., and that's happening in many other countries, and we hope it'll help answer this question. So right now, our guidance is based on the available science, and we use that also science around other coronaviruses, and it suggests that the incubation period ranges from about 2 to 14 days, and that patients are most contagious when they have a fever and other symptoms. Let me just touch a little bit on what's changing in regard to travel health assessments at our ports of entry. CDC and our Customs and Border Protection, we continue to conduct enhanced entry screening of passengers who have been to Wuhan within the past 14 days at 5 designated U.S. airports. CDC and CBP, which is Customs and Border Protection here in the U.S., we routinely respond to reports of ill passengers at all of our ports of entry, and so we're going to enhance that effort. And going forward, our CBP officials, they're going to monitor travelers with symptoms compatible with coronavirus and look for a history of travel to Wuhan in all travelers from China across all of our quarantine stations, and there are 20 in the United States. At the same time, all travelers from China will be given CDC's, it's called a travel health alert notice, and it's to provide education for travelers about what to do if they get sick with certain symptoms within 14 days after arriving in the United States. So this really helps CDC to focus efforts on rapid detection, isolation, and contact tracing, we hope by educating the traveling public. As Dr. Druckmann mentioned, the WHO is meeting today, their emergency committee, and I do expect that to come out while we're here together today. And then also, WHO announced an agreement with China that a team of international experts will visit China soon to work with the Chinese government to improve our understanding of the disease. And we're very hopeful that that will make a large contribution to curbing the spread of this disease. So let me just touch on CDC's recommendations for travelers to and from affected areas and countries. I mentioned this. We currently recommend that travelers avoid non-essential travel to China, and that includes Hubei province. As you know, there's been a shutdown around Hubei province, and I think it can be fairly unpredictable. We'll hear what that's like a little bit. And so there may also be limited access to adequate medical care. For people who must go to China, we certainly recommend that travelers remain alert to avoid contact with sick people, avoid animals, wash their hands often, and certainly do not travel if you're sick. Those are very important things that should be occurring all of the time. We don't currently have any travel health notices for novel coronavirus for any country other than China, but we continue to monitor the situation in countries where there have been imported cases, where there is limited human-to-human transmission, and we will be informing travelers as information evolves. So the last question, what do we recommend companies do to prevent novel coronavirus in the workplace? A couple things I would just point out. It is currently flu and respiratory disease in the Northern Hemisphere, and we certainly recommend doing things that you would normally do this time of year. So flu vaccine is very important, and taking everyday preventive actions to stop the spread of germs. If you're a healthcare provider, be on the lookout for people who have recently traveled from China and who may be sick. We do encourage businesses to help educate their employees about the novel coronavirus, particularly for those that are traveling international. And we do have a fair bit of information and guidance on our website that can be available for healthcare providers and other businesses. We recommend that you ensure you have guidance for staff who might be exposed to the novel coronavirus. Be sure you know how to advise staff on how to access healthcare wherever they may be, and know how you will support staff who may get ill overseas. The last thing I think I'll touch on is the issue around masks. This seems to be coming up a lot, and we see a lot of pictures of people using masks. In general, CDC does not recommend mask use for people who are well. We recommend masks be worn by people who are ill. There's no real data to show that mask use is effective in communities for people who are well. And so we do recommend that you save them for people who are sick and for healthcare providers who are working in risk environments. So let me stop there, and thank you again for having me today.
Terrific. Thank you, Dr. Idix. This terrific summary of kind of where we are today. And I'm going to move into China, and wanted to highlight a couple interesting bits of research that's been done by an organization called RIWI. And what they do is they collect anonymous, unincentivized data, polling data from communities. And this particularly is coming from China. And it's looking at basically what is the level of confidence that the local community has in their health officials in treating and avoiding and treating the coronavirus. And interestingly, you can see the numbers increasing as the outbreak has gone on. At least the number of great deal of confidence is over 60%, which is really quite dramatic and maybe not intuitive with a lot of us looking in on what's happening in China. And even more so when you ask the question, is it going to get better or worse? 80% are saying it's going to get better. And so really a very, positive view that's coming out of China. And if you look at the provinces that are answering, you can see many of those are in the hot areas that where a lot of this is occurring. So with that as a starting point, I want to introduce Jim McGregor. And Jim, the whole situation of what's happening on the ground, both from the perspective of being an expat and living there for 30 years, as well as all of your local, residents and employees and all of the businesses that are there, how would you kind of summarize where things are at?
Well, Miles, thanks for having me. I left China 2 weeks ago on a business trip, and I'm now at my summer home in Duluth, Minnesota. It's not summer here, of course, and I'll be staying out of China for a while. But I sent out an email to about 75 friends 2 nights ago and asked them for what they're seeing, what life is like, and what I heard back from them actually goes along with the survey you just had. Let me tell you why I think that is. Wuhan is the Chicago of China. If you're going to have an outbreak somewhere and have it spread, this is the place to do it. It's where the rivers, the railroads, the bullet trains, the highways all meet. It's a manufacturing center. It's a university center. So it's a big crossroads. When people heard that the mayor say maybe 4 days ago that 5 million people left Wuhan before they clamped down on it, that got the whole country paranoid. People in Shanghai and Beijing are worried that people from Wuhan would go there because of better medical care. And then, they scattered all over for Chinese New Year's all over the country. So there's a very, very tight clampdown now, and people are going along with it. The Communist Party, as it always does, has got all kinds of slogans plastered everywhere in the villages. They've got loudspeakers. Some of these slogans, here's a couple of them. Visiting each other is equal to killing each other. Having a party together is suicide. That's one slogan. Another one is, today you visit someone's home, next year you will visit their tomb. And there's a whole bunch of these slogans. And in the villages, they're going door to door. They're looking for people who may come from Hubei, the province, or Wuhan, the city. Or they're just checking on people's health and seeing how they are. And really, the party people, their job is to monitor everybody's health in their region and to report back. And actually, in Shanghai, a friend of mine who runs a school there told me that her administrators and teachers, the kids, of course, school has been delayed till February 17th. But the teachers are supposed to get a hold of every kid or their parents every day and check on their health. And then by 9 in the morning, they have to upload this to Education Commission database. That just shows how tight this is. People are hunkered down in their homes in villages and in big cities. They're only going out to get food in the supermarket. And people tell me you go out in the morning because that's when you can get stuff. If you go in the afternoon, things are sold out. Food is still being delivered to the cities, less than usual, but those are state-owned enterprises. The government's got those people delivering. And also remember, people have gone home for Chinese New Year's, and there's, that's when it's like Christmas and Thanksgiving combined. It's just everybody's stocked up on all kinds of food, so I don't think anybody's going to go hungry anytime soon. The government's view, the view of the government, Chinese people are very skeptical of their government. They're used to living in a propaganda world. They're very angry with the mayor of Wuhan and the leadership of Wuhan. They let this thing fester for a month without making it public, and actually arresting some of the early doctors who were going out on the internet and talking about it, arresting them for rumor mongering. Actually, I think some of them have been released. The Supreme Court, in an astonishing memo, came out against those people being arrested, and tried to cut that down. I've never seen anything like that in China before. And so people are now saying that the government is central government, because they did so badly early on, is being quite transparent now and having press conferences all the time and putting out information. And the government, there's one person said to me, if the government is telling the truth, how are we going to believe they're telling the truth? Because we're used to such sanitized information. When it comes to companies and businesses, the expats, some of the multinationals are evacuating entire expat families. Others are encouraging expats to leave and go home if you feel uncomfortable. But many of them are waiting it out offshore, because they were already offshore for Chinese New Year's vacation. And so some of these people are extending vacations in Bali or Thailand or Switzerland or wherever. The business is gonna take a hit from this. I talked to a friend of mine who runs about 35 factories in China, and he said that his quote to me is, "Q1 is already dead for us. We're just not going to be able to get through this." He said construction is shut down all over the country, except for probably these hospitals they're building. Transport, suppliers, people are worried about credit and money and how long this goes on. But actually, if you look back at SARS 17 years ago, that was a big hit too. But by the end of the year, both retail sales and GDP were higher than the year before. So if this thing doesn't go on for too long, China should be able to recover economically. So in general, I guess to sum it up, people are hunkering down. They're wearing masks. They're not leaving their house. The government is monitoring everybody. And the sanitation, people's apartment buildings, they're in there spraying the common areas, the stairways, the hallways, sanitizing them every day. They don't let people into other people's compounds. So we'll see. It looks like they're doing what they can to do the isolation quarantine that is needed for a disease like this.
Jim, that's an incredible summary. One quick question before we move on. What about the travelers from China going outwards? Are you seeing organizations saying to their China-based staff, we don't want people to travel to the US, we don't want people to travel to Europe because of the potential for quarantine and issues, or is that not been an issue?
No, I think companies are not having people from China go to the U.S. for any kind of business purposes. And expats who are leaving and going home are being quarantined by many companies for 2 weeks. Notice the Australians are putting them on an island, Christmas Island, 2,000 miles offshore, kilometers offshore from Australia. So there's a lot of quarantining people when they leave. But I think business travel is basically dead.
Yeah. Wow. Okay. Well, with all that good news, let's see what everyone on the line thinks. What we're going to do right now is get your, in a sense, temperature, no pun intended, Let's first look at the results from last week. This is the level of concern of the respondents on the webinar last week, which was 54% were very or extremely concerned. We're going to put a poll up here in just 1 second, which is going to show. We want to know how many staff do you actually have in China? So I think that poll is going to come up right now. So we've got just 30 seconds. We'd like as many people as possible to fill that in. So the options are: we don't have any staff in China. There are only travelers, less than 50, 50 to 500, 501 to 2,500, or 2,500 plus. So just fill in kind of best estimate of your organization and their footprint in China, because I think that does affect how concerned initially some organizations are is their actual people that are in the system. So that is now out, and you can see we have 44% on the line have only travelers, 20% are less than 50 people in China, 16% are 51 to 500, 9 is 500 to 2,500, and 11% are over 2,500. So it's a fairly good mix. And you can see, interestingly, only travelers is the largest group. So I'm going to go to the last week's slide quickly to look at this number. And if we break this down by industry, it's not surprising that the #1 industry that's most concerned about this is travel and tourism. And we've seen that almost completely shut down, or if I would say completely shut down. And you can see if your industry and what your level of concern was all the way down the line. So what I'm going to do now is go to the next slide, which is basically where are we today. So we're gonna post the next poll, which is exactly what we did last week, and we want to see, has it changed? So are you extremely concerned, very concerned, moderate, low, or not sure yet? So we'll give you 30 seconds or so, hopefully, to respond there, and we'll give you your immediate feedback of that situation. Okay, so we have 13% extremely, 48%, so almost half are very concerned. It's an important priority, 36%. So we're at slight increase over last week. We're at 61% versus 53. So actually about a little over, almost an 8 or 9% increase in concern between the very and significant. And if we look at the next situation, the next question we asked last time was, what are you doing? And you can see the percentage, 70% were really focusing on their travelers, and 12% actually had banned travel to China already last week, purchasing and distributing masks, preparing for point of entry screening or doing it, and no actions. So a third of the people last week had no actions. If we focused on the people that actually banned travel, you could see the business units or the business industries that were kind of the most prominent with banning, and most, I would say, risk-averse industries. You could see them listed there. And what we're going to do next is we're going to post the same questions to the group here today. So the first, and you can select any of the following here. So are you giving advice and monitoring travelers to affected areas? Are you banning travel to China? Are you purchasing or distributing masks? Are you preparing for and performing entry screening? Or you're considering, but you really haven't taken any actions yet today. So we'll give you a couple seconds here to fill that in. Appreciate all your feedback, because this is really where you guys can get hopefully some useful information of what your peers are doing. So we're at now 35% of you are giving advice to travelers, so that's interesting. So it's a less of a number, and over 50% have banned all travel to China, which is a pretty dramatic number. Distributing masks, a very small percentage, and preparing for entry, small percentage too. and 10%, so more, significantly more people than last time, obviously doing something. And then finally, we have one last poll, which is for some additional actions you might be taking. And again, just select one, the ones that you can select multiple ones here. So one is travelers from China. You do not want them to work, or they're working from home, WFH, work from home for the 14 days. Is that one of your policies? Or travel from China, you're letting them work, but they monitor themselves. Are you planning to, or have you relocated any expats? Are you planning to, or have you relocated any Chinese staff? So we've seen that as well within China. And have you stopped or closed any or all of your operations in China? So how impacted have you been with your operations? So we'll give you some time as well for that one. So you can see 72% are really saying you're either working from home or you're not working and you're quarantining. So Jim, very much in alignment with what you just said, whereas 20% are saying, yes, you can come to work, but monitor yourself. Relocating expats, a small percentage, very small percentage for relocating staff. And stopping operations, almost 20%, which is pretty significant too. So we'll make sure you have all of those numbers going forward. And with the remaining time we have, let me just summarize a couple key things that we're looking at from our side about what managers should do. As we discussed last time, your groups are your total workforce. One of the concepts that's coming up is, do you have people in an affected area? What's the definition of an affected area? How significantly impacted is it? So these are kind of analyses that organizations are doing to identify, what's the right level of intervention that they want to put in place. And the interventions, as we've said, is a lot of communication. It was a small percentage that were doing point of entry screening, but we're seeing that significantly in certain parts of China. And point of entry screening can be passive with a poster, or it can be active with a questionnaire and even a temperature check. As you saw, masks are in very short supply in many parts of the world, particularly in China. So people are using other ways of trying to protect themselves. The cleaning issue is evolving rapidly. Jim talked about that. And so organizations keeping their place clean is another big issue. And of course, having virtual meetings, remote work, all of those things are coming into play right now as well. Staff issues, the same as last week. The big thing is monitoring your health if you've been in China and on return. And then finally, on our side, we're seeing a huge surge in activity, on this platform we have, continually updating a lot of documents and providing a lot of alerts to groups that have operations now globally around the world. So very, very active on the international SOS side as well. So kind of where are we today? I think the message is that a very rapidly evolving dynamic situation. I think it's very appropriate for organizations to plan for further spread. There is some research coming out that we may not even see a peak until April or May of this year. So this is going to occur for many months. And your plans are going to be very specific to the location. If you have operations in Wuhan, you're doing different things than if you're in Shanghai, than if you're doing different things than if you're in New York. And I think, as Jim said, the business disruption could be significant. And there is this potential, and we'll find out what the WHO says about this, whether this is a public health emergency of international concern. They probably announced it while we were on the call, but we'll continue to keep you advised. So watch this space for more additional webinars in the future. Hopefully this was useful for you. And thank you very much for your attention, and everybody have a great day.